Yeah, so definitely have experienced issues with data quality. And I would say that I think the biggest thing we're doing is the data governance around that. And, you know, he spoke about it a little bit earlier. We are aligning stewards within the organization that, you know, it's not their full-time job, but we're making it very clear that there are people who are responsible for the quality of the data. And we've got stewards, and then we've got what we like to call trustees, which are like VP level people in the organization that are now going to be held accountable for the data that they are trustees of. And I think that's probably the biggest thing that we're doing that I believe will improve the quality of our data, is by just making it clear who's the throat to choke and who's the person to talk to when you have a problem. Because currently it just gets passed around, right? The business side thinks it's an IT problem, the IT side thinks it's a business problem, and the thing just circles around and circles around and circles around. So the way that we've been able to, I think, make a really good change is by creating this responsibility matrix.
So I'd say a little bit different. So I don't have 240 clinical databases. I couldn't even imagine that. But, you know, our problem is not necessarily, so we're mainly health insurance for government-based programs. We can't go and choke a state's throat, right? That's our partner, right? So we get, you know, variety of different data that is of, you know, questionable quality. You know, let's be honest. And as well, we also try to partner with hospitals and our providers. And again, you know, we want to partner. We don't want to, you know, necessarily disenfranchise them. So we deal with a lot with bad data. We spend a lot of time cleaning it up, is all we do right now. Where I see it going, and there's probably a level 6 or 7, Cliff, which is, you know, starting to look at some of the AI and the mediated, you know, APIs that can figure this stuff out on its own. Because what are we basically doing? We're looking at it and we're saying, well, this kind of lines up and that kind of lines up, so we need to clean it. Wouldn't it be great if we could all do that with, you know, some of the automated, you know, AI type things? And so that's some of the things we're dabbling in, you know, for some of the more, you know, structured data. The unstructured data, you know, now we're talking NLP and, you know, some of that other types of things to clean it up in advance beforehand. So it's not an easy answer in healthcare by any means.